Life is precious. From our first steps to our last, our journey is unique. As we love and work, laugh and struggle, face challenges, and find peace, we travel a path that is entirely our own.
I sometimes talk about the journey of life as like a hiker in the woods, and people go into the woods and come out of the woods, but the question we often want to deal with is, how are you going to leave the trail?
Hospice of the Western Reserve is dedicated to providing physical, emotional, and spiritual support at the end of life's journey.
End-of-life medical care is directed towards comforting the patient. We are no longer looking at curing the patient, but we are instead looking at caring for the patient.
Each situation is unique, and helping individuals come to terms with their condition takes cooperation and compassion.
Patients and physicians should be talking and communicating at all steps along their therapy.
Although the patient's primary physician continues to direct medical decisions, a team of doctors, nurses, nursing assistants, volunteers, social workers, and counseling staff help to meet the needs of the patient and family in realizing their goals. Medicare, Medicaid, and private insurance frequently covers the cost, but regardless of age, disease, or ability to pay, Hospice of the Western Reserve provides services throughout Northeast Ohio. For many families, this makes it possible to care for the patient at home.
Anything we needed, anything we wanted, they'd talk to the doctor, her physician, and he'd say, well, we better change her meds, her pain medication, or we better get this supply in. And it was almost like you'd hang up the phone and they'd be there. Someone would be ringing the side door with a delivery of a prescription or any kind of supplies that you would need. So we just felt so well cared for, and we were so clueless. It was so comforting.
Paula grieves the loss of her mother, but praises the hospice team.
They were extremely kind, compassionate, treated us with respect, and yes, they see it every day, but they made it very special. This was your mom. This is what happens, which was sort of her attitude anyway. They were extraordinary.
To lose a parent is overwhelming. The loss of a child seems unbearable. But even in such painful circumstances, the hospice team helps smooth the hard road.
My family has never gone through something like this before. With her nurse, her social worker, her music therapist, her volunteer, they've been through this. They've worked with many families who are in the same situation. They can identify a lot more. They are able to advise and suggest things that myself and my family haven't even thought of.
Karen did not choose this journey, but is determined to cherish the time she has left with her young daughter.
I credit my hospice social worker with the emotional counseling she's been able to give me. She's put things into perspective for me. I've understood now that tomorrows are not guaranteed, and what we do to make today is what counts. And I will not have regrets when the time is to say goodbye.
At such an emotionally charged time, it's important to realize that a patient's needs may change. There are still choices to be made, and there are common concerns.
Within hospice, we feel that pain management is a priority, and we feel that we're experts in trying to help achieve pain relief for our patients.
Even if a person is not ready for hospice care, our palliative care program offers support during the earlier stages of a life-limiting illness. Our healthcare team collaborates with the patient's physician to manage pain and symptoms, ease suffering, and encourage choices in end-of-life care. Along with pain management, the hospice team also encourages personal growth, even at this critical crossroad.
The second mission that we have is to assure that they have every opportunity to experience life to the fullest. That means the idea of growth, the idea that there is still life to live and things to do, places to go and people to see, but it's perhaps not as physical.
No one symbolizes this better than Leroy. At home with his wife of 53 years and surrounded by grandchildren and great-grandchildren, Leroy's heart condition is life-limiting, but his spirit is boundless.
I was down to 184 pounds a year ago. And I was in the wheelchair. From the wheelchair to the walker. And from the walker to the cane. And now I don't have to use nothing but Leroy.
As his hospice nurse, Debbie and her fellow team members gave Leroy a new perspective on his condition.
She came in, it was a positive future thing. It was something that, okay, we have this here, but what do you want to do? You know, how do you want to live your life? It was like it's a quality of life, you know.
That focus on quality of life helps Leroy and his family truly appreciate the time they spend together and gives his family members peace of mind. Advanced care planning also provides peace of mind. By filling out the simple forms in our Advanced Care Planning booklet, anyone at any age can prepare for their future. Making your health choices known before developing an illness keeps you in control and eases the strain for everyone.
Advanced care planning is taking care of issues that might arise if you're not able to take care of yourself at a future time. If you're ill and you can't make decisions for yourself, you plan in advance with a family member or somebody of your own choosing to make those decisions for you.
Some patients, like Leroy, plan to finish their journey at home. For others, hospice care may be provided in a hospital, nursing facility, other long-term care setting, or the comfortable surroundings of hospice house. Here, spacious single rooms ensure peace and privacy. A home-style kitchen and dining room offer a casual retreat for family gatherings, and the bright, open atrium is a catalyst for conversation and companionship.
You know, once we accepted our mom was going to die soon, we just wanted to make sure that she would be as comfortable as possible. Not only, like I said, physically, but also spiritually and emotionally. And I feel that this was a good place to be for that to happen.
When the journey ends for the patient, many challenges remain for those left behind. Through the many programs offered by the Elizabeth Severance Prentice Bereavement Center, grief counseling takes many forms. Anyone who has experienced a loss due to death, not just family members involved with our hospice care, is encouraged to participate in our various support groups and activities. Individual counseling, massage, art therapy, even customized outreach sessions that extend to schools and the workplace help individuals move through the grief process.
Well, first of all, you have a facilitator that, you know, is well-versed in this and leading you through it. And just different issues come up. I think, you know, we all want to stifle our tears. And it's okay to cry here. Everybody's handled in a very gentle way. Your story is respected. And, you know, there is support there for you.
This fabric and feeling session is one of several other forms of grief counseling offered by Hospice of the Western Reserve.
This is a quilt that I'm making in memory of my mother, and going through her things after she passed, I ran across a lounger that she had, and I wanted to do something to commemorate her.
Things come out, they just come out in the images, and it goes so deep inside that it touches your feelings, your innermost, your deepest feelings, and it bypasses all the junk. It bypasses the words, it bypasses the holding back, it bypasses everything and gets to the heart of the matter. It's sadness and laughter and tears and happiness and joy and grief and loss and love. It's all that.
At this crowning phase of life, Hospice of the Western Reserve offers comprehensive palliative care along with heartfelt compassion.
Hospice was the light, our light. because we knew where we were going, they knew where we were going, and they got us there with their, you know, this is what they do.